Hi guys, it's me Ty here coming from Da Nang, Vietnam, and today I kind of wanted to talk about a little bit about dental work because I just had some stuff here where I had to run to the dentist. For the last, I don't know, 2 years here, I've just been so busy with work and everything, and I needed a lower dental retainer, one of the plastic clear ones, because I used to wear braces. Mine wore out. So now that I'm taking the 6 months off here and not going back to work until until May of next year, I got plenty of time in my hands. So I'm in Vietnam here, and I was like, well, now's a good time that I can actually finally get a dental retainer made. And back in the United States, I used to always pay anywhere from $75 for a clear plastic retainer to $150. And as many of you know, earlier this year here, I had a dental implant done in Cambodia, and they charged me, I believe it was $150 for my top clear plastic retainer. So I figured maybe here in Vietnam I'd have to pay that amount, but actually the dentist that I typed into Google here, it was just a random one. I just typed in nearest dentist office, went in there, and they're like, yep, we can get you in right away. And I asked them how much it would cost, and it came out to $64 for them to make it, and it took them exactly 2 days to make it. And they did a good job. It fit kind of tight in the beginning, but they said that when they're new that they tend to fit really tight, and then after they start getting wore in, they're good. And I've noticed that here now in the last few days, it fits really nice. But I also wanted to talk about if you should get dental implants or a bridge, because I've had a lot of dental problems over the years, and I have spent a lot of money on dental work over the years. And for dental implants, I could never afford to get it done in the United States. I've had 2 of them in my life already. The United States, they wanted so much of them that I was actually driving up to Canada, and they have better oral surgeons up there than the United States, by the way, just because we pay more than they do, and we don't pay much more than they do. They actually do have better stuff. I mean, just because somebody charges you more for something, they kind of pull the Jedi mind fuck on you. So yeah, but yeah, my surgeon over there that did mine up in Canada, he was 25% cheaper in the United States, and that took 1.5 years from start to finish. So you are taking out a lot of your time and being miserable of not having a darn tooth in your mouth over that kind of period of time, because it was a molar, so it just, the bone grafting has to heal for so much longer in all the different stages. And then the one here in Cambodia, that one only took, I believe it was 5 months from start to finish. But that was a front tooth, so they don't do all the chewing, so that's why the orthodontist and oral surgeon, whatever, said that I could get that one done faster or whatever. And he didn't really say I could get it done faster. It's just that he kept doing his x-rays all the time and checking, and finally it was well enough done. So now we are at the point of, would I get dental implants done again, or would I recommend a bridge? And as of right now, the dentists in the United States, they make so damn much money off of dental implants, and well, any country they do. There's just, I paid $3,500 to have that front one done in Cambodia, so it's still expensive over here too. And coming to Asia here, where vanity is on a whole different level than the United States. I mean, you come to like countries like Thailand and stuff like that, and these people go through so much plastic surgery for beauty and everything. Yeah, I'm gonna go by what these people are doing here. So, like my girlfriend here in Cambodia, she is just a bombshell. She is beautiful as hell. And what she did, like I always thought she had such nice teeth or whatever. Well, one day she comes to pick me up, and I noticed that pretty much mostly all of her teeth were ground off. And I'm like, what's the deal with this? And she's like, actually, I have the inserts. She has actual dentures where she has some of her teeth, but she's missing other ones. And just some days, you know, your gums get sore. And that's what she does. She's got the removable, I guess whatever you want to call them. I guess there's, like the dentists say, there's 3 options. You can get a dental implant, or you can get a bridge, or you can get these insert teeth or whatever, like a dental retainer or whatever with fake teeth on it. And then one of my other buddies from Germany here too, that's what he opted to do too. He's got really nice teeth or whatever, but I noticed that he was missing quite a few of them some days or whatever. And then another girl that I'm really good friends with here in Cambodia, that's what they all do. They actually do like dentures. And actually my girlfriend, she eats with hers too. Hers are like strong enough for that or whatever. But like I said, every once in a while their gums obviously must get swollen or whatever, and that's what they've been doing. But that's not what I want to do. And I was kind of raised by the older generation, like my grandparents and older people in the community. So like one of the older guys, he's like 86 years old, and he's got this, one of his front teeth is black. And I asked him about that one time. And he said that he actually went back in the day when he was 26 years old. So that many years ago, his tooth, it was gonna fall out or fell out or whatever. Well, the surgeon, I believe it did fall out. The surgeon went ahead and he ran a stud through his tooth into his lower jawbone, and it's held up all these years. But I haven't found a dentist really that wants to tackle something like that. Because like all these newer dentists, they haven't been trained in all that experimental stuff that the older generation of dentists used to do. And then like my grandma and grandpa over the years, they used to go in for dental checkups every 6 months for their clean. They were big into preventive maintenance on that stuff. And I always remember that my grandma, she had a bridge on one of her front teeth. It wasn't the very front one on the bottom. It was probably like 3 or 4 from the front, maybe, yeah, probably 3 or 4 from the front. And I always remember that it had a metal wires in the back, almost like it was braided or whatever, almost like a mesh back there. And that held up for her for years. And I believe, and she always went in for maintenance too, you know, if it ever needed to be glued. And she said that's called a Maryland bridge is what she got. Because all the dentists out there, like when I asked about bridges, they all try and scare you. They're always like, no, that's not how we do bridges anymore. They're like, when you're we go and pull your tooth, and then your 2 good teeth, your tooth on each side, we go and grind it down to just a nub. We just destroy that tooth on each side, and then we put a 3-piece crown that fits right over those 2 good teeth that we destroyed for you. And then eventually that'll fail or whatever. Well, you don't need to be worried about that, because I talked to a whole bunch of the other older generation around here too, and they're like, we got the Maryland bridge done years ago where it just secures to it, and they might do a little bit of prep where they cut into your enamel a little bit, but they sure as heck do not grind like super deep into your teeth or nothing. And if that thing ever does break loose, like you would bite too hard on a nut, you go into the dentist and he re-cements it in there for you. And the only reason that on my front tooth here that I had to do, that I didn't go with the bridge, was I have 3 teeth that are dead in the front. I was involved in an accident. So this tooth here that became really loose in the front, it was the middle one. And I was aware that if I go and get that one pulled and get a dental implant there, now I will have a good solid tooth on each side. So for my front teeth, from now on, I'm gonna be doing the Maryland bridge, and even the back teeth, I'm kicking around the idea of that. But definitely any of your front teeth that are not the actual molars, I would do the Maryland bridge. Don't do the other type of bridge where they grind yours down to a nub, and just do the Maryland bridge, and you guys will be so happy with it. The dentist always says, oh, it'll only last 7 years. Well, 7 years is a long time before you got to go back in and just have them do some patchwork or just putting some re-cementing it if one wing breaks off. So, all right, well, I hope this helps you guys, and if you guys like this content, I will keep kicking out videos here from Da Nang, Vietnam for you. So, all right, take care, you guys.